while, and thought I'd take this opportunity to kind of do a live now and tell you about what's going on in the world of My Heart MD and the new forefronts here. So first of all, it's great to connect with you guys live. I love doing this stuff, and work gets in the way. So I love seeing who is from where. It looks like there's Cardiovisual, and thanks for joining. Deep Blue's on. A bunch of people I recognize already. It's fantastic. So let me know where you're from. I'm here in Boston, Massachusetts, USA, and I was trying to delay this IG Live a little bit to get our audience in other parts of the world who, just a bit different time zones. So it is about 9:17 here in Boston. Beautiful evening. I hope you guys are having a nice weekend also. So bunch of people joining up. Thanks so much. Here's the thing, right? So, hey, listen, Thailand. I love it. Thailand, Pennsylvania, Scottsdale, Arizona. I love Scottsdale. Been there a couple of times in my old aviation days. I used to fly there. So where else are we looking at here? Let's take a look here, all right? Cardiovisual is one of the things we're going to be talking about today because they are a key part of this broadcast. So let me just jump right in and talk a bit about what we're doing. My Heart MD and Cardiovisual are joining up this year to talk a bit about the forefront of cardiology and emergency medicine and pre-hospital care. And the entire idea is to bring you guys cases that are sort of, pre-hospital through the ER and ultimately, what the experts, the cardiologists find. So it's going to be a great series. It's called Heart Heroes Frontline Care. We're starting it up. It's starting up next Tuesday, the 22nd, this coming Tuesday. And, the first case we have for you is something I think that is really, really interesting. What I'll do is I will send you I'll send the ECG and a short blurb on this in the next day or so. So you can take a look at the EKG, see what you think, and that way when we go live on Tuesday, you'll have an idea of what's going on. You can kind of think about the EKG and see what the discussion is all about. Now, this is a really interesting presentation because it's going to sort of incorporate the pre-hospital folks. The pre-hospital care is something that we sometimes take for granted, saying, hey, they just kind of show up and these things are done, and they're all done pretty well. But I really wanted to make sure we got the sort of the perspective of paramedics in a case like this. And so, not to spoil the EKG, but this was a guy, a highly trained athlete who was, I think, a 7-time marathon runner, came in and had chest pain, and you'll see the EKG and you'll get an idea of what the concerns were. But the entire format is going to be to look at the EKG from a pre-hospital standpoint, digest it, see what the thoughts were up there, see what the initial ED management was, and ultimately what the end outcome was in the cath lab. And we'll talk to the cardiologist who'll be on and get that, get the perspective there too. So, it's still a big problem, right? Heart disease is a big, big problem. And I think it's still the leading cause of death here, at least in the US, with hitting all ethnic groups, all gender groups. It's a big, big problem. And I think, I'm not sure, I think the data says something like 1 out of every, I think a person dies every 33 seconds from heart disease. It's terrible. And we have an incredible opportunity here to make a difference in the outcome of these patients' lives. So hope you guys can join me. The focus on this case is going to be chest pain, and an abnormal ECG in an athlete. And so take a look at the EKG and see what you think. The prevalence of heart disease is still, there in athletes. And we'll talk to our consultant, Dr. Paul Tucker from Austin, Texas. He's an interventionalist and a great guy. You'll love him. And get his take on things like how do we evaluate patients who come in with chest pain who are athletes, who are runners, and what is their risk? And how do we treat them differently or not? Are they exceptions to the rule of our risk factors that we look at, like diabetes, hypertension, hyperlipidemia, or do those rules also apply to those master athletes, right? And then we'll talk about things like, okay, so you've got a person now with chest pain, if there's an athlete who's got abnormal changes, looks like a STEMI maybe, but how do you treat that? Do the same rules for intervention apply to those patients also, or is there something else? And finally, I hope we get a chance to get his perspective on things like, when you treat these patients, they do well. When can they return to their normal activity, like running marathons? That's an important question that I get asked all the time. Doctor, when can I go back? When can I start exercising again? And so this is something that is a important question to answer for our patients. We'll explore that idea and also explore the concept of, specialized screening. These athletes come in and there are a bunch of things like history, exam, ECG, stress test, coronary calcium, scores. What do those different testing modalities, how do those modalities help us determine a person's health or risk of disease? So anyhow, that's what it's going to be all about. It's coming up this Tuesday, the 22nd, and we'll have a post for you and tell you exactly. It's going to be 5 p.m. or I think it's going to be 6 p.m. actually local time here in Boston. But we'll have more of that kind of detail for you. And also, given the structure of this, we will absolutely, answer all the questions that come through, but maybe not on the live, because I'm sure the program is going to be packed full of questions and data and things like that. So we will probably do something like take your questions and then get back to you with the answers. But be rest assured that every question will be answered. That is a promise. So again, this is going to be a joint effort from between MyHeartMD and Cardiovisual. Those guys are an incredible team, great faculty. You're going to love them. And we're going to be talking to Dr. Paul Tucker, interventionalist from Austin, Texas, and Benjamin Pozzadolo, big name in EMS here in Boston and New England, regional chief of paramedics. Great guy, great insight for pre-hospital care. And that's it. So any questions so far? A lot of waves. I know some questions came by. I don't see them right now. That's right, Tuesday, 6 p.m. I'm going to scroll here and see what I can do to answer any questions for you. And, guys, this thing we do here in MyHeartMD is really, it's Instagram, it's free, it's, highly vetted data. We screen it. It's the best that we can do. We really make sure it's accurate. And when we do make mistakes, and I hope we don't actually, but if we do, please point them out to us because we have a way of checking data, fact checking, and I only want to make sure that we give you the most accurate data out there. I saw a couple people here asking, and sir, where are you from? I am from Boston, sir. Boston, Massachusetts, USA. It's about 9:30 here, and where are you from? All right, so Dixie Gypsy saying, can't wait. We'll be there with you on Tuesday from the fire department. Excellent. Looking forward to you fire really plays a critical role. You guys are first responders, obviously, and more now, you're being held to a higher level of care. So I'm really interested in seeing your perspective on what kinds of patients you've seen out there in managing patients with things like, heart attacks and STEMIs, things like that. Yeah, so great, I'll be there. Chicago Cath Lab RN, and Nikki Island. Well, Nikki, very nice meeting you. I hope you enjoy the program. It's going to be great. And if you have any insight on your practice, your experiences, please share them with us. We're always happy to hear from you guys. Getting some questions here. Yeah, a bunch of medications. Yeah, so these are all questions that you can actually ask Paul Tucker. Dr. Tucker will be happy to take on some of these questions. These are complicated questions, so these things about statins and things like that, we probably can't get into right now, except that the latest data says that if you're an athlete and you have a high calcium score, you might actually benefit, significantly from being on a statin, even if you don't have other kinds of risk factors. So, but a great question for our interventionalist. All right. So it looks like we have a whole bunch of people from all over the world, from India, USA. I saw something from South America. Really fantastic. I'm so glad that you guys are all, interested in this subject material. It really is amazing. Can you please repeat which date and time? Well, I sure can. The day is going to be Tuesday, this coming Tuesday, August 22nd, 6 p.m. Eastern time. And we'll send a post out to you the next day or so you can make sure that you get it. All right. Well, I'll tell you what, guys. What's the link between smoking and heart disease? Well, that's a big question, right? I was in Italy just about a month ago, and I was pretty struck as to the fact that people still smoke in Europe, and it's something that I think that's creeping along, and people are quitting more and more. But there's a direct correlation. I think the single most important thing one can do is to quit smoking in terms of prevention of heart disease. So there's a very strong link, my friend. But again, I think that the numbers are, we can give you better numbers on that. Ask that question about smoking. I think it's an important one. Every once in a while, I still see people who smoke, and we can actually educate a lot in that regard. All right, so great questions, guys. Important questions for us to be able to answer. I'll be ready to take notes. Yeah, feel free to take notes, but also enjoy it. Sit back. Hopefully it'll be a thing where you can just sit back and enjoy and kind of take things in passively. There'll be the time, I think there'll be plenty of opportunities to take notes if you'd like. Okay, I'm scrolling through some of these questions, and oh, wow, this is incredible here. Are you enjoying your life? This is from Vu2E. Well, yes, I am. Life is good. Summertime here in Boston is always good. We had a rainy summer, but it's okay. We're being told here by the weathermen that and women that it's going to be a warm fall. So hopefully we'll keep enjoying that. All right, very good. So folks, I'm going to sign off here. We've been on for about 15 minutes, and I wanted to just introduce this concept to you. It's a collaborative effort between MyHeartMD and Cardiovisual, great faculty at Cardiovisual. You guys should follow their site for sure. Fantastic information. And the idea, once again, is to collaborate, right, and bring in some new concepts and really talk about cases in this series called Heart Heroes, and take it from the pre-hospital standpoint to the cath lab. And by the way, if you guys follow me, you know that these cases are all real cases. Nothing's made up, and therefore nothing is perfect. There's some, some sort of rough edges to these cases because they're all real, and nothing in medicine is perfect. So I stick to that. We do nothing fake here. It's all real cases, real people. I sometimes bring on real patients on these lives to talk with them and get their perspective on how they felt during a heart attack. It's fantastic. Maybe we'll do that if you guys would like to see more of that. So we'll do things that I think you guys will like. All right, I'll tell you what. Thank you so much for joining up. I'm going to sign off here. We'll do maybe one more live before this program. So just to remind you and let you know how things are going. For now, this is Serge from MyHeartMD, and speaking for myself and the good faculty over at Cardiovisual on this program. Good night and so long.